Hi, my name is Adrienne Ularik. Today I'm going to be presenting on bulimia nervosa, what the disease is about, what causes it, risk factors, management, treatment, etc. This topic is actually very near and dear to me, you could say. I struggled with an eating disorder for about 9 years or so. Last year I got onto a medication called Paxil, which completely took away any of the bulimic tendencies that I had, such as overeating and purging. It was just absolutely amazing. And that is also part of the reason why I'm planning to go into pharmacy this coming August, because I would like to get into research on bulimia and drugs that target the symptoms of bulimia. So a little bit of background, and I'll be able to provide some personal experiences as well to this presentation to add to its relevancy. So bulimia nervosa is an eating disorder. It's characterized by cycles of binging and purging. So binging in which you're overeating large amounts of food, you're raiding the cabinets, and then you feel so guilty afterwards and you try to get rid of these excess calories that you just purged on, whether it be, 10 brownies or a whole pizza. You try to rid yourself of those calories by self-induced vomiting, which in this case is called purging. Purging is most common. Some individuals use other means as well in addition to purging, including over-exercising. So instead of going to the gym for an hour, you go for 5 hours to try to work off those excess calories. They may use laxatives, or again, other means to get rid of those excess calories. And it's also worth mentioning that during these episodes of binging, the individual will feel as though they have little to no control over what they are doing, which this is a very important factor in why people with bulimia cannot just turn it off. They literally feel like they cannot do anything else. They have to eat, stuff themselves until that moment of realization comes in of what happened. And then they try to regain that control by purging. Signs and symptoms of bulimia nervosa I will talk about in these next 2 slides. So, of course, some of these signs include obsession with body shape and weight. So the individual may be worried that they are too heavy. A lot of times this is impacted by social expectations of being really thin, having that model look. Individuals will also fear gaining weight. Of course, a lot of people do, but this is just an obsessive fear. They also have recurrent episodes of overeating. Again, like I talked about in the previous slide, they will feel out of control during these episodes. And then, of course, after these episodes, they will self-induce vomiting, or they may fast for an entire day to make up for those calories. They also, again, may do or engage in excessive exercising, use laxatives, diuretics, or enemas after an episode. Now, from an outsider's perspective, if you suspect an individual is bulimic, there are many warning signs. For example, there may be large amounts of food disappearing. Maybe you had a whole package of Oreos in the cabinet, and the next day they're gone. You may find lots of empty wrappers floating around, maybe in the trash cans, as well as containers. And also, of course, because of the self-induced vomiting, that individual may smell like vomit, and their breath may smell very, very bad. Another telltale sign is that the individual may go to the bathroom frequently, especially after eating, because they feel so guilty about eating, so they're going to go to the restroom and purge. Also, it's very common for these individuals to develop what we call food rituals. For example, in my case, I had to set morning, lunch, and dinner times, and they were set, they did not change. My meals were set and did not change. I had certain fear foods, so pasta, pizza, anything carb related was a fear food for me and a trigger food for me. So those were foods that I would eat during a binge cycle, but that I would fear out of a binge cycle. Symptoms that are very common: you can tell a person is bulimic and has been bulimic for a while due to discoloring of their teeth. A lot of times you'll see yellow teeth or their enamel is heavily eroded, and this is because of the stomach acid that is brought up during a period of vomiting. You may also see sores on the individual's knuckles from them putting their fingers into their mouth and their teeth scraping against those knuckles. A lot of times you'll also see swelling of the parotid glands right in the back and around in the jaw area. This is noticeable because the individual will have puffier than normal cheeks and will appear swollen. Other signs include electrolyte imbalances and heart arrhythmia, which we'll talk in the pathophysiology slide. Also weight fluctuations, so they may gain 15 pounds and then lose 15 pounds really quickly because of those periods of bulimia, vomiting, and fasting. You may also see broken blood vessels, oral lacerations, of course, from, again, it's going to be that stomach acid kind of burning through that tissue in your mouth, chronic dehydration, chronic gastric reflux, and an inflamed esophagus, again, all related to the damaging effects of stomach acid. First, we'll talk a little bit about the history. So, like most diseases and disorders, bulimia nervosa is not new. It's been around for probably almost as long as humans have been alive. Probably, I would venture to say more so since social expectations have become so prevalent, in which we almost worship thinness. But there have been historical references to the act of vomiting since the ancient Egyptians. So we know that ancient Egyptians purged themselves every month for 3 days in a row. They actually believed that human diseases came from the food they ate, so if they threw it back up, they weren't going to get sick. In the Middle Ages, purging was used for the same reasons as bloodletting. They was thought to be like a treatment for certain diseases. There's been documentation that Romans would use a feather, and they would stick it down their throat to induce their gag reflex and vomit after they ate. Of course, this doesn't directly say that, yes, those individuals could be diagnosed with bulimia, but those are definitely telltale signs and symptoms of bulimia. Now, in the early 1900s was really when bulimia first kind of made a entry into the public awareness. So a French psychologist named Pierre Janet wrote a book that documented women who binged in secret. And then in 1979, Gerald Russell, a British psychiatrist, actually conducted the first official research on women who were attending universities in North America, and what he found was that they actually engaged in the bulimic behaviors we know today, which would be, overeating and then vomiting afterwards. And he was trying to relate it to the occurrence of anorexia, and he found that individuals who had anorexia nervosa were at a higher risk for bulimia nervosa, or at least exhibiting the signs of bulimia nervosa. And then, of course, throughout these last few years, more and more research has been conducted as bulimia nervosa has been accepted as an actual ailment, right? So the causes and risk factors associated with bulimia are not very well fleshed out yet. I wouldn't say they're as well known as, say, diabetes, for example. But we do know that the occurrence of bulimia, the reasons behind it, is multifactorial. Definitely includes genetic, environmental, psychological, and cultural influences. So stress, abuse, or trauma If an individual had a very stressful childhood or were abused, they have a higher risk for developing bulimia later as kind of like a coping mechanism. And then negative body image and poor self-esteem. Those are definitely precursors to developing bulimia. I remember when I was in elementary school, I would stand in front of a mirror and look at my stomach, and I would say, oh my goodness, I'm fat. So it starts at a very young age as well, that negative body image. And then definitely working in a profession that is appearance-oriented. So say you're a model, for example, right? A lot of times we see those images of really, really skinny women walking the runway because they're expected to look a certain way. Also, if you're a performer, if you do dances, things like that. If you're in the public eye. And interestingly enough, women have a higher risk of developing bulimia than men. So if you're a woman, you have a higher risk. An individual who has a parent or sibling with an eating disorder are also more likely to develop an eating disorder themselves. Interestingly enough, my mother had bulimia when she was younger, and of course now I do. My sister, who's around the same age that I was when I first was diagnosed with an eating disorder, does not have any signs of an eating disorder. So, but it is very interesting, and it is possibly hereditary. Also, adhering to a calorie-strict diet for too long is a risk. So in my case as well, when I was around 15 years old, I started restricting the foods that I ate, thinking that it was healthy, and eventually I lost about 40 pounds and was then diagnosed as anorexic. And this backfired on me because my body went into starvation mode and felt like it wasn't getting enough food. And so I developed bulimia, and my body overate to compensate for those lost calories. However, once I became a normal weight again, the bulimia symptoms did not disappear for me. So it was long lasting. And then also associated with having a higher risk of being diagnosed with bulimia or developing bulimia is having a personality that is obsessive or highly perfectionist. This also applies to me because since I can remember being in school, I was obsessed with getting good grades. While my friends were out partying, I was studying 8 to 10 hours a day. Even if it was just to gain 2% more on that exam, I would spend, a whole bunch of extra hours studying. I had to have that A+. So your strengths can definitely be your weaknesses. Some statistics about bulimia. So the epidemiology of bulimia, about 1 in every 25 women are affected by bulimia nervosa at least once in their lifetime. So some have it for the rest of their lives, others kind of get over it or maybe just have relapses. So this translates into 1% of women have had bulimia or have bulimia. And about 0.1% of men, same thing, have bulimia or had bulimia. Interestingly, for the last 20 years or so, studies have reported similar rates of new diagnoses of bulimia, so it's not like the diagnoses are going up or down. It stayed pretty much the same. However, interestingly enough, the age at which the eating disorder symptoms appear, or at least are being diagnosed at now, is becoming younger in both males and females. For me, I can say it started around the age of 15. Here we have the statistics that about 40 to 60% of girls in just elementary school are already concerned about their weight and becoming overweight. Also, personality disorders are a common co-occurrence with bulimia nervosa. They found that about 11% of individuals with bulimia also had obsessive-compulsive personality disorder, right? Kind of going back to the OCD we were talking about, the perfectionist personality. 28% of individuals diagnosed with bulimia have borderline personality disorder. And then 36 to 50% of individuals with bulimia nervosa have major depressive disorder, and about 54 to 81% are additionally diagnosed with anxiety disorder. And I can attest to that because prior to being on medication, I was extremely anxious And every now and then I would have depressive episodes, but primarily I was anxious every day. Every day. Some more, like we kind of talked about before, individuals in aesthetic sports like dancing, swimming, are more likely to develop bulimia. In individuals who are 14 to 15 years old, dieting is the most important predictor of developing eating disorder. I, with my own experience, can attest to that. So I severely restricted my food intake at that age, and according to these statistics, those who do so are actually 18 times more likely to develop an eating disorder than those who do not diet. Kind of on the darker side, bulimia nervosa has a 3.9% mortality rate. Eating disorders in general are the second highest cause for deaths. Studies using twins show that binge eating, purging, fasting are about 46 to 72% heritable. This was using monozygotic twins to make sure there were no possible environmental factors influence that could occur through, if you just use dizygotic twins. And then, again, like I said, the bulimia, the causes have not been very well fleshed out yet. So definitely more studies need to be conducted on genes that show kind of the connection between, are you more likely to develop bulimia nervosa than somebody else? So far, really most of the attention has been given to anorexia nervosa. Probably due to the reason that anorexia nervosa is more deadly than bulimia. So some pathophysiology, bulimia nervosa can cause severe damage to the body. And so, of course, there are many pathophysiologies that can result. So one of the major ones is hypokalemia. So hypokalemia in this case is due to vomiting. So when you vomit, it results in hypovolemia, right? You're throwing up all this fluid. And what happens is there's a decrease in the blood volume that's circulating in your body. As a result, aldosterone is secreted, right? Because your body's like, hey, I need, more fluid. I don't have enough fluid in the blood. And so what happens is that potassium levels in the body are decreased through urine excretion, right? And so this increases sodium in the body, and therefore the amount of water that gets into the blood. However, if this is chronic, low potassium levels are not good, even though that is your body's response under normal conditions. But if you're causing yourself to vomit, right, you may develop chronically low potassium levels, which will result in muscle cramps and irregular heartbeats. In addition, your stomach can rupture from too much food volume if you're stuffing your face and you're eating and you're not really paying attention to how full you are, or your hunger cues are completely off. Your stomach may fill to the point of rupture. It's rare, but it has happened. More commonly, the esophagus will tear or become damaged from the stomach acid, right, as it's burning through that tissue coming up. If you're chronic bulimic, it's been known to have a connection to esophageal cancer, right, which makes sense because that tissue is going to become malignant after so many traumatic injuries from the stomach acid. And then also enamel erosion is very common for the same reasons that esophageal tears are, stomach acid. Stomach acid is just absolutely gnarly outside of anywhere but your stomach. So it will erode the enamel of your teeth, and of course this can result in mouth pain. You'll have difficulty swallowing, your gums may bleed, that sort of thing. So in order to diagnose bulimia, there is an accepted DSM-5 criteria. This includes 1, the individual has repeated episodes of binge eating. So binge eating is an event in which an individual eats more food during a period of time than most individuals otherwise would in a similar period of time. And then, of course, like we were talking about earlier, during an episode, the individual may feel that they cannot control what they are eating or how much. And then after an episode, that individual will try to regain control and then compensate, of course, for the episode and the excessive calories from that episode by self-induced vomiting, taking, again, diuretics or laxatives, over-exercising, or fasting. And then number 3, an episode occurs an average of once a week for 3 months. So in my case, I was having bulimic episodes probably 4 times a week for years. And then the number 4, the individual's view of themselves, of their self, is influenced primarily by body shape and weight. So I was never happy with myself, for example. I was always very concerned about how much I weighed. I would pinch myself, for example, to see how much body fat I had. It was obsession. And then number 5, bulimic episodes do not occur just during episodes of anorexia nervosa, so it has to be separate. Excuse me. Some water. Okay, so management of bulimia. So bulimia nervosa is best managed by a combination of psychotherapy and medication. In my case, I tried psychotherapy. It didn't work. Purely medication worked for me. So that was fantastic. I'll talk about it a little bit once I get to the bottom of the slide. So psychotherapy encourages patients to, talk about their episodes of bulimia with somebody who is certified professional, psychologist, for example, or a psychiatrist. And together they will develop a plan or a way of thinking about the episodes of bulimia in order to manage and minimize the occurrences of a bulimic episode. You may have cognitive behavioral therapy, so that's just identifying unhealthy and negative beliefs about oneself. You may have family-based treatment, which encourages family involvement. If a family member sees that you have certain signs of bulimia, maybe you're going to the restroom frequently after meals, they'll come in, stop, and talk to you. And then interpersonal therapy helps to just improve close relationships, helps to improve communication, maybe stressful social situations that may trigger those bulimic episodes are all worked through in those types of therapy sessions. Now, antidepressant medications, particularly selective serotonin inhibitors, SSRIs, have a high success rate of reducing bulimic episodes in patients. And mainly this is because they work by making sure that serotonin kind of stays in the synapse a little bit longer, right? And so for me, this was the best treatment. I know that, so for example, Prozac is the only FDA-approved SSRI for treating bulimia nervosa, but that's bulimia in and of itself. I told my doctor I have anxiety and I would like to try Paxil, and which is also an SSRI, and that one worked for me completely. Started taking it, and I have not had an episode for about 1.5 years. It's been absolutely amazing. So apparently I had some kind of deficiency in serotonin. But other medications important or known to have or known to reduce incidences of bulimia are Zoloft and Lexapro. The prognosis with bulimia, so about half of all individuals diagnosed with bulimia nervosa will, make a full recovery. I'd like to say that I am part of that 50%. The remaining half of all individuals, however, may be on some kind of spectrum, so they may either be partially recovered, perhaps they will experience relapses during certain times of stress or trauma. They also may still have abnormal relationships with certain foods and abnormal eating patterns, so perhaps they still fear, carbs, for example, or maybe peanut butter is still their trigger, but they are not binging as much as they normally would on other foods. Some individuals just never recover at all, unfortunately. I guess the good thing about bulimia nervosa, if there is a good thing, is that it does have a better prognosis than anorexia nervosa. The mortality rate for anorexia nervosa is extremely high. Current research being done, they've determined several possible factors that have some kind of influence on the development of bulimia in an individual. Again, like I was talking about, unfortunately, these are just not completely fleshed out yet by research. I really want to be part of that research, so I hope to flesh out the causes even more. But for now, what's very interesting is that patients with bulimia nervosa excessively secrete ghrelin, aka the hunger hormone, right? So ghrelin induces hunger. So patients with excess ghrelin are going to be constantly hungry, constantly wanting to eat, and they may not know when to stop or when their body has calorically enough food to survive. What's also really interesting that I found kind of relates back to the genetic factors of bulimia is that polymorphism of the ghrelin receptor gene, you may also know it as the growth hormone secretagogue receptor, GHSR, is associated with conditions that have bulimic type symptoms, right? So like hyperphagia, for example. Hyperphagia is a condition in which the patient, again, eats and does not know when to stop. This GHSR receptor, it is known to be involved in the increased secretion of growth hormone, right? And so growth hormone, of course, especially in kids, if it's released, it's going to say, hey, we need more food to supply our body with the nutrients it needs to grow, for example, right? So it's also associated, at least polymorphism of that gene in Prader-Willi syndrome, which is typically diagnosed in children. What happens is that that child who is diagnosed with this syndrome becomes extremely weak and fatigued. They may have poor muscle composition, and over time they will become extremely hungry. They will overeat too. They won't know when to stop, and oftentimes this will result in obesity of that child, as well as diabetes too. Another connection is there between uncontrolled compulsive eating and drug addiction. So it's almost like bulimia is an addictive behavior, but rather than drugs, it's for food. And so researchers have found that individuals in either of these two groups tend to have lower dopamine in their brain. So it's hypothesized that perhaps individuals are overeating in order to increase the activity or dopamine in the brain's reward system, right? Overeating feels good, that dopamine's being released, and you want to keep doing it to get that high feeling. Lastly, we'll talk about some well-known individuals with bulimia nervosa, just to perhaps make it kind of relatable or on a personal level. I think a lot of people don't realize how prevalent bulimia is in society. So take, for example, Princess Diana. She actually became very vocal about her struggle with bulimia. She struggled with it for over 10 years. And, excuse me, water again. She cited low self-esteem, so body image problems, as well as an unhappy marriage, so stress, and extreme stress, just being part of that palace royal life, for the reasons why she would overeat and then purge. It was good that she was so open with her struggle with bulimia, because it definitely was key to finally making the public aware of this disorder. And of course, probably encouraging more research to be done. And also Jane Fonda, she struggled with bulimia until her 40s, so decades. And she cited her perfectionist personality, like what we talked about in the earlier slides, as for why she did. She also cited society's push for certain body shapes, right? So like that skinny model, thin figure, as the reason why she used bulimia to control her body and weight. to meet society's expectations. Finally, Elton John. So a man struggled with bulimia for 16 years before he sought help. Initially tried to recover on his own, but I tried to recover on my own as well. But eventually you do realize, just like he did, that you need treatment, whether that's in the form of psychotherapy and or medication. And so same too, just like Princess Diana, his admission helped to bring awareness to the public, right? You look up to these kinds of celebrities, and so them being so open with their own struggles, I think makes it society a little bit more acceptable to the idea that there are such disorders that exist. It's not something somebody is doing for attention, for example, right? It's real. Others include Lady Gaga, Dennis Quaid, Paula Abdul, and Susan Dey. So this basically concludes my presentation on bulimia nervosa. I hope that it was informative for you and well explained. Here's my works cited, the last couple of slides, and that is the end of the presentation. Thank you again so much for watching, and thank you so much for allowing me this opportunity to be a part of your class and for the opportunity to learn so much about a disease that kind of hits home for me. So thank you.